Good day and welcome. I'm Nicholas, a therapist working in Chiswick, Cirencester and online, offering therapy and EMDR. And today we're going to talk about EMDR, joined with my colleagues from the practice, Cris, Elspeth and Monika, who also integrate EMDR. So we're going to have a little discussion about our use of EMDR, and Monika will give an introduction as to what it actually is. So first of all, I'll just hand over to Cris so she can say hello and introduce herself a bit. Hello, Cris.
Hi, Nicholas. I'm Cris. I'm a psychotherapist here in London. I work in Kensington and online, and I also use EMDR in my practice. I'll hand over to Elspeth.
Thank you. I'm Elspeth. I work mainly with children and young people. I'm a psychotherapist and I work online and in person, and I also used EMDR in my practice. And then hand over to Monika.
Hello, I'm Monika. I'm a psychotherapist and I work online and in person. And I use EMDR with adults and adolescents, young people, and I also see couples. So I just want to say a little bit about EMDR. EMDR is a therapeutic technique. I use it as part of my therapy. And it's a brilliant technique in that it helps to lower distress levels. So the idea is the client thinks about a memory, the distressing, upsetting memory from the past. And then we do some processing whilst the client is thinking of the memory, and it lowers the distress levels, the upset levels, of any memory from the past, anything at all. And the way that affects our present is that clients have often talked about feeling lighter or more relaxed or more confident, and just more able to get on with their lives. And it's amazing how EMDR actually works with pretty much anything from self-esteem to grief to low mood and depression, of course, to any upsetting, distressing, traumatic events in the past. And, and anxiety works very well with anxiety. Sometimes only one session is enough, and sometimes we need more than one session. But just to say, it's a very good, effective therapeutic technique that we all work with and we all integrate into our work. So that's my bit about EMDR.
Thank you, Monika. Cris, Elspeth, anything that you want to add at the moment?
One thing that I also tell my clients when they worry about not doing it right is that there's no wrong way of doing EMDR. So there's nothing to worry about. Oh, am I doing it right? Can I make a mistake? No, there's no possibility. You are doing it right. And the other thing is that sometimes clients ask about reflections, or if they need to think about or reflect or find reasons for it. And that's also something that it's not needed. It's a very particular technique that we don't need to really reflect on what we're doing. The brain does it, and it's different than the psychotherapy part where we reflect on meanings or reasons and things like that.
Because I've found it particularly useful where people may struggle to talk about a particular event or memory because of feelings of maybe shame or embarrassment. Because one of the wonderful things about EMDR is that the content doesn't have to be shared. But when we're doing the EMDR, of course, what we're interested in as the therapists is whether something is actually happening. But we don't need the person to, in a way, break out of the processing to tell us what's happening, which in therapy often can slow people down. So it doesn't. So in a way, the normal therapy doesn't get in the way of the processing. So EMDR is really great for that. I think that's fabulous, and I've integrated it with my clients, in as much as the way I think of it is it's almost like the standard therapy, gets you to a point of really being able to understand what's perplexing. That there can be, for example, if somebody finds that a particular situation makes them angry, they know it makes them angry. They kind of think it shouldn't make them angry, but we can't understand what's exactly happening there. That we use the EMDR on that. And usually what happens, there's a shift, really. There's a kind of, there might be a memory from the past. Oh, yes, I remember this situation made me very angry and I'd forgotten that. Yeah, or there's a sense of, oh, okay, that, yeah, next time I'm in that situation, I'll feel more relaxed. And that's generally kind of what happens. The other response I had was that sometimes I also use things that are happening in the present and also thinking of the future as well. So future situations, and also chronic pain as well. EMDR is now being used for chronic pain. And of course, as therapists, we always work with kind of there's doctors in the background because, of course, therapy picks up where the medical profession leaves off. But yes, it's possible with chronic pain as well, EMDR. Yeah, yeah.
I'm going to say, I think it's very, very effective, very simple. And like Cris was saying, and like you were saying, Nicholas, you don't have to describe your trauma. You don't have to describe what's really upsetting. So that's just, it helps so much. You may not want to, or maybe you can't verbalize it. You just have to remember it. So like, it's a neurological process, really. So very different from talk therapy, but a very effective tool.
Mm.
And actually, in my work with the children and young people, it's adapted to the different developmental stages. So we can use a more creative approach with images or storytelling. And as we've said, it can be used for many issues, primary issues, secondary, and so on. It can be very flexible and effective.
Would one of you mind speaking a bit about using it online?
Say briefly that I use it online and it's just as effective. So I will just be there with the client. I'm not in the room, but I'm watching the client closely, and I'm watching as the client is either moving their eyes left and right, or tapping like this, left, right, sort of this sort of tapping. So I'm watching them and I ask them to pause every sort of couple of minutes, and then we yeah, and I check in with them, what's going on, how are they feeling, what are they thinking, what are they remembering, and then we go back to processing, and it works just as well. Yeah, I've seen hundreds of well, hundreds, dozens of clients, many clients doing it online. Yeah.
Yeah, I have the same experience, Monica, that it works online really well. And it's just really having the capacity to observe the client in the window, the little window, to see if they are choosing the eye movement, if the eyes are moving. And yeah, it's quite simple. Yeah.
Mm. One thing that the person that created it, Francine Shapiro, apparently she said she'd called it reprocessing therapy because EMDR, eye movement desensitization and reprogramming, it does. It's based very much on the very first way in which this was done, which was with pure eye movements. Whereas with sounds and also bleeps that are used in taps, the eyes might move, but it's not that you're getting the eyes to move. So depending on which the technique is that's used. So that's I think worth clearing up now that it's still called EMDR, but maybe it's changed a little bit from where it started. The other thing I like to think about is how it's often the case that people, when they're stuck with something, there can be a sort of a self-critical part. That what can be tricky is that someone internalizes something that maybe they should have done something differently, or that they don't matter in some way. And part of this, it is about a person coming out of this often with with a kind of a kinder understanding. And I think because what happens is that the brain is very good at protecting us in the moments of something traumatic. It gets us through them, but we don't always get a chance to process what's happened. That life gets in the way, that maybe there isn't someone to talk to after a nasty event, or there's just not an opportunity to spend time reflecting. So I think this is why there's sometimes a sense that, oh, if the brain is stuck, there's something wrong with the brain, and I think that's not what happens. I think the brain does a really good job, and what we do is we just help the brain to do something which it didn't get a chance to do at the time for whatever reason. So yeah, I think it's a wonderfully compassionate kind of therapeutic approach. And of course, the client tells us that, don't they, what they want to work on, and they're in charge. We're kind of like almost stewards of the process, I suppose. Yeah.
Interesting. It's been called therapy on speed because it works so much faster often than talk therapy. I mean, it is a tool and we use it together with talk therapy, but it can sometimes people gain insights quite quickly or realize things like you were saying, Nicholas, sort of memories and things come up and that they hadn't realized. And yeah, so it's very effective, fast and effective.
And it can change the negative beliefs that have actually been created by the trauma as well.
Mm.
Yeah.
And just maybe lastly, because people might wonder, well, why EMDR now? For me, because of course I've been working as a therapist like yourselves for many years, 20 years, and I first came across EMDR 20 years ago. I wasn't really certain at the time, um, but over the years, I've just seen more and more evidence and heard more and more and witnessed more and more of people finding it helpful. And of course, EMDR is one of the therapies that the NHS have on their NICE guidelines, for example. And it is considered to have a lot of scientific evidence behind it. So um, I guess because it seems like something which is kind of unusual. It's like a tool that it's for me anyway. I'm well, I think I've integrated it at the right time, but now I feel like it really is time for people to be able to make benefit from it. So that's kind of why now for me. I'm not sure about yourselves, but
I often say to clients, this will look weird. Or, when I say, yes, you need to move your eyes or tap, this might seem weird, but it's very effective. So yes, I can empathize with people who might think, well, this is very bizarre, but it works.
Mhm. Yeah, me too, Nicholas. I was introduced to EMDR like 20 years ago, and I was maybe a bit suspicious or just not interested enough. But then as time passed and I started listening to other therapists talk about EMDR, I was like intrigued until deciding to go into the training. And then when we work with the clients, it's such a nice tool to have. As Monica was saying, there is like a speed to the process and also a kind of a sense of that the client achieved something in a session in a different way that it where like that it feels in general when we are doing the talking therapy that we take like some time to process a few things and then suddenly we do EMDR and they leave the session feeling like, oh wow, it doesn't bother me anymore like as much, and we're like, oh, interesting. Yeah.
Yeah, it's so interesting.
good. So I guess to bring our little meeting to a close, I think that the hope was that people would kind of see us first of all, so know who it is that's offering EMDR, and to hear about kind of what it is and a bit about our experiences and why we are offering it and working with it now. and yeah, that we work online and in person. We're based in various places. So there's Chiswick, there's Earl's Court, there's Cirencester for me, and Elspeth. Where you're working in person
Well, up in Hornsey,
in Horn
town in Yorkshire,
as well.
and
So,
online. Online is works well too. Yes.
yes, anyone watching this that would like to start EMDR, just contact the office, and our administrator will arrange an initial appointment with us. So yeah, thanks very much for watching, and hope you found this interesting.